In this session, I want to introduce some stabilization techniques that you can use when working with complex trauma. So in my last EMDR series, when I talked about phase 2 of EMDR, which is preparation, resourcing, and stabilization, I mentioned a couple of stabilization techniques that you can use when you're doing EMDR, but I want to really take some time to expand on that and focus on the context of complex trauma. So when we think of complex trauma, a lot of times we think about childhood trauma, ongoing trauma that usually involves some relational ruptures or some attachment ruptures. So it's when people hurt us most of the time. So resourcing or stabilization strategies for this type of trauma can be a little bit different than what's emphasized in classic EMDR. So in classic EMDR, the two types of resourcing techniques that are usually taught are container and secure place. So just as a reminder, container is this metaphorical item that clients come up with in their mind to store their stuff, their traumatic material, and they keep it in that container until they come to session with you, at which time they pull it out of that container, work with it, and then they put it back in that container. So it's their way of learning how to contain traumatic material. And a lot of clients find this strategy to be incredibly helpful. The other common strategy that's used for resourcing in classic EMDR is secure place. Now, this used to be called safe place, but it was noted that for some clients, they've never felt safe, so we call it secure place. And in this metaphorical place in our minds, what we do is we create a place where we feel comfortable or secure, and we really focus on the sensory experiences with this imaginal place. So the two types of resourcing techniques that are most commonly used in EMDR are cognitive, okay, so they're top-down techniques, and they're places. Okay, so around the theme of places. I'd recommend that when working with complex trauma, we expand that also to people and also emphasize some bottom-up stabilization and resourcing techniques, for instance, diaphragmatic breathing or progressive muscle relaxation. So I want to go into a little bit more depth about these strategies. So not only can we come up with, in our mind's eye, places that feel secure or places that make us feel calmer and more stable, but we can access people in our mind. So some common examples of this would be called nurturing figure or protective figure. And in these processes, what we're doing is we're having clients think about a person. It can be a person that they've known, maybe a wise grandmother, for instance, or maybe a caregiver. And they imagine this person as a protective figure or as a nurturing figure. And they imagine what that person looks like, what they sound like. And they imagine perhaps what that person would be telling them in a difficult situation. So the idea is to be able to access these imaginal resources during times of difficulty or emotional upheaval. Maybe, for instance, if during the desensitization phase, it gets to be too much, that distress level rises too high, and they run the risk of exiting that window of tolerance that I discussed. They can access these mental resources to feel more grounded and more stabilized. So these resources can be these people. Nurturing figure, protective figures are the most common ones. Laurel Parnell has also added to that wise figure. So someone that you think about who is wise, whose recommendations or advice you would take that you would find helpful. So think about incorporating people as these resources in addition to these places. I think the reason why this is especially important in complex trauma is because, again, it's usually characterized by these attachment ruptures. And we know that how people heal a lot of times is through other people. So being able to access these safe and grounding and stabilizing figures can be immensely helpful to individuals who've suffered from complex trauma. Here's the challenge, though, with this. A lot of times with pervasive developmental complex trauma, you'll find it's the case that for some of these clients, they've never experienced other human beings as being protective or nurturing or wise. So it can be difficult to access these resources. When this is the case, what you can do is you can create resources. And these resources can be used, again, in these desensitization and installation phases of EMDR, or just also as a mindfulness practice on their own outside of session. So if these clients have a hard time identifying people in their lives who have been safe and secure, maybe come up with them in the imagination. So an example of this might be coming up with what we call an ideal parent. It also might be God. Okay, so it might be a person that they have never met. Might also be someone that doesn't exist, like the ideal parent or an ideal best friend. So what you can do is you can ask them, during that traumatic event, what would you would have hoped would have happened? Who would you would have wanted to have been there? So let's say you had a mother who stood by and didn't intervene as maybe a father or a stepfather was abusing you or mistreating you. What would you have wanted her to do? And from this, what you can do is you can craft an ideal parent and then focus on that ideal parent. Now, where you're going to run into some difficulty with this with some clients is that they can push back against this and they'll say, that's not what I had. That would have been great to have that, but that's not what I had. Here's what I had. Here's what you can tell clients if you face some of this resistance. I found that children are actually much more receptive to this process than adults sometimes are. But think about it like this. You can say it like this to them. Remember that whenever you think about something, you're always activating a neural network. And the more you activate a neural network, the more you build that neural network. So neurons that fire together wire together. And with repeated experience, we strengthen or we weaken these neuronal bonds and these networks. So maybe you don't have any network in your brain for an ideal parent because it didn't exist. You didn't have this. But what we can do is we can hack your brain. We can actually trick your brain by having you think about an ideal parent. And in thinking about this ideal parent, thinking about what they sound like, what they look like, what their behaviors are, how they interact with you, what you actually do is you create a new neural network in your brain for this ideal parent. And you may be thinking, well, yeah, but who cares if this parent doesn't actually exist? But what's really interesting is that when we activate these neural networks, and we think about these people, whether they're fictional or whether we've ever met them or not, we still activate the neural network, which then fools the lower areas of the brain and the body into thinking it's true. So when you have a thought, oh my gosh, I'm going to die, you can evaluate that thought with these top areas of your brain. And you can step through it and you can say, well, am I really going to die? Was that just a thought about how I'm going to die? What's actually going on? And you can evaluate whether or not that might be accurate. But when you tell yourself, I'm going to die, it sends signals downward, so efferent signals in the brain, downward to the lower areas of the brain and the body. And it turns out that those lower areas of the brain and the body don't really know the difference. So what that means is that we can calm these lower areas of the brain and the body with our thoughts, even if we're thinking about a situation or a scenario or a person that doesn't exist. What we're wanting to do with these clients is build networks that don't exist because they didn't have those resourced experiences. So yeah, they're not true, but we're still going to hack your brain into thinking it's true. We can still relax the body with this. And the more they access these imaginal figures in their mind, the stronger those networks become. Which is why, for a lot of our clients, the network that's attached to God can be so incredibly strong. If they're praying every single night, they're activating that network every night. Over a period of months and years, it gets quite strong. So this can be a resource that they can draw upon. So when working with complex trauma, be sure to expand beyond those imaginal places to people. Really focusing on people, and if they don't have people that they can access readily, that they have networks for, don't hesitate to help them begin to create those networks. And then have them activate those networks outside of session as a part of a mindfulness or as a part of a meditative process where they're strengthening those networks. And then we can bring those networks in during times of distress to help them stabilize or re-stabilize and feel much calmer. The other thing to really focus on with complex trauma, and I would say with trauma in general, are stabilization techniques that work from the bottom up. So when we're talking about imaginal resources, we're really talking about top-down resources or cognitive resources. And classic EMDR really emphasizes those. But I also think that we need to emphasize the bottom-up piece. Remember Peter Levine saying that trauma is stored in the body. So we also want to work with the body, and we can calm the body, thereby also calming those lower areas of the brain, such as the amygdala. So some ways to do this would be through a focused diaphragmatic breathing exercise or a progressive muscle relaxation exercise. Another one of my very favorites is something called autogenic training, where you're promoting the redirection of blood flow in a strategic way to promote parasympathetic arousal, which is the relaxation response in the body. I'm including with this series an autogenic training script, so if you want to take a look at that, you can use that. I think this combination of bottom-up techniques along with the top-down techniques and really emphasizing that phase 2, really emphasizing those resourcing tools is critical when working with complex trauma. And it better sets you up for the later phases of EMDR where they're going to face some of that really difficult material and feel more confident in doing so.